Reports of pediatric COVID cases have been on the rise, with the American Academy of Pediatrics reporting nearly a 240% increase in cases since July. Will schools remain open this year, even if youth COVID cases continue to rise?
That's critically important that we monitor that and we look to see how that's happening. And what we're finding, unfortunately, is that where we're seeing rise in cases is predominantly in places that are not using the mitigation strategies that we know work. We'd be doing a disservice to our students not giving them an opportunity to learn in person where they learn best. They've suffered enough. Let's follow what works. Let's monitor the spread. And what I can tell you, Chris, is what we found, not only this year but last year, is spread happens in communities. And oftentimes, when the community spread is high, it walks into our school. Nobody wants to hear about pediatric cases of COVID. We're monitoring it closely, but we know that across the country, we have schools that are reopened without issues because they're following those strategies that we know work.
Los Angeles County recently required vaccines for children aged 12 and up. What happens with children whose parents refuse to get them vaccinated? And should more counties and states follow LA County's model?
As a father, again, for me, the health and safety of my children is the most important thing. And the moment they were eligible for vaccine, we were there in line like everyone else. And I breathed a little bit easier when I knew both my children were vaccinated. And, we're partnering with the health department, with Pediatric Association to help inform parents of the benefits of it. Listen, we didn't wake up this morning thinking about measles because that was behind us. There was requirements for measles vaccine, and it's no longer an issue. The same is the case for COVID-19. We know how to protect our children. So let's protect them. It's really about messaging and helping share information. People are nervous, people are scared. So as the vaccine becomes eligible for younger children, we want to make sure parents have the right information. Yesterday, I was in a clinic that worked in partnership with the school to inform parents and the school community the benefits of it and help allay whatever fears they might have so that they can make the decision to vaccinate their children and protect their children.
A recent CDC report highlighted some health issues that school children are facing during the pandemic, specifically an increase in obesity. How can school help reverse this trend?
Our students, that's a good point. Like, a lot of people don't think about that. Our students have been more sedentary this last year and a half than in previous years. So when we reopen schools, we have to make sure that we're giving our students not only social and emotional engagement with their peers and fun activities to kind of want to be back there, but also move around, having them, do trips or be more physical activity, more recess, more, PE classes. We have to engage our students in extracurricular activities. I feel strongly every student in the country should have access to an extracurricular activity where they're not only building social skills, but getting out, moving more, going to see parks, getting on field trips, doing things that we know students love. We as educators now have to rethink how we're welcoming our students back.
Another education trend that's been reported is a decrease in college enrollment since COVID. Why do you think this is happening?
Many of our college-age students had to work. They had to go and help support their family. There was a lot of job loss. We even had that with high school students who had to help supplement the income of their families and had to go to work. That's why in the ARP, the American Rescue Plan, there are funds intended to re-engage students and get them back into college, get them matriculated, and help them kind of get back into it. They need more now, not less, and we have to work twice as hard now, especially for those students that may be disengaged early or just feel like, I'm done with this, I want to move on. It's our job as educators to re-engage them and really give them opportunities to get back on track so that they can reach their potential.
President Biden's recent vaccine mandate includes businesses with more than 100 employees. Are schools included in that mandate, and are teachers and other school staff required to get vaccinated?
Some schools are, right? Private institutions are, private schools are, and some public schools are if they're under, an OSHA contract with their states. But it's not all of them. That's why it's really important that we get the message out that we encourage state governors who do have that authority to work with their legislators and really move forward with legislation on requiring vaccines to do their part as well. In those places where they're more aggressive about requiring vaccines, you're seeing less school interruptions. You're seeing less disrupted learning. You see kids not having to worry about missing their football game, missing their soccer game, their volleyball game. So we know what we need to do. FDA approved it. There's no reason why we're not moving forward as a country.
Cardona, nice to see you as always. Thank you so much for joining us on this ASP Chat.
Thank you so much for taking the time on the bus. We appreciate it.
Always good to see you guys. Take care.